Certainly, the greatest fear of any parent is the death of their baby. And for this reason, we're going to discuss sudden unexpected infant death. Specifically, we will cover what you can do to lower the risk for your baby. The causes for sudden unexpected infant death, in many cases, can't be explained. However, what we do know is that most occur while the infant is sleeping in an unsafe environment. What makes up sudden unexpected infant death? There are 3 types. Sudden infant death syndrome, commonly called SIDS. This is a sudden death of an infant that cannot be explained after a thorough investigation. Accidental suffocation and strangulation in bed. Suffocation can happen by soft bedding or pillows, wedging or entrapment, or when another person rolls on top of or against the infant while sleeping. Strangulation, for example, can occur when an infant's head and neck become caught between crib railings. Unknown cause. This refers to the sudden death of an infant that cannot be explained because a thorough investigation was not conducted and the cause of death could not be determined. While there is still a good deal of research to be done, here are some confirmed statistics. Each year in the U.S., there are about 4,000 sudden unexpected infant deaths. These deaths occur in infants less than 1 year old. SIDS is the leading cause of sudden unexpected infant death, and the highest risk is between 2 and 4 months of age. In this video, we will focus on how to reduce the risk of SIDS and accidental suffocation and strangulation. So let's look at the 9 steps you can take to reduce the risks to your baby. Put your baby to sleep on his or her back. The safest place for babies to sleep is on their backs, in a crib, bassinet, or play yard. Never place these items by a window, as it creates a risk of strangulation on blind cords or drapery. Always place the baby to sleep on his or her back, even for short naps. And make sure the baby's head and face are uncovered while sleeping. So why is this important? It's important because when a baby sleeps on his or her stomach, it increases the chances of suffocating because they have not developed muscle strength to adjust if airflow is cut off. Check your baby's crib. Be sure the crib is sturdy. Specifically, check the width of the railings to make sure your baby's head cannot get stuck between them. And make sure to check the crib has no gaps or variances so that babies cannot squeeze through or fall out of a broken or improperly constructed crib. The crib should have a firm mattress that is covered with a fitted sheet. Do not place any pillows, blankets, or stuffed toys in the crib with your baby. Thick cloth bumpers or any material that restricts airflow in the crib is not recommended. Room share. Don't bed share. Do not share your bed with your baby under any circumstances. During sleep, you can unknowingly roll over your baby. And the comforters and pillows that are no harm to you represent an extreme risk to your baby. They can easily be swallowed up in big blankets and can suffocate. Dress your baby in light clothing so he or she does not overheat. Sleep sacks are a safe and comfortable way to dress your baby for sleep, and they eliminate the need for additional blankets. Keep the room at a moderate temperature. Keep the room temperature at a moderate setting that is comfortable for you. Watch the baby for signs of sweating or overheating, which may increase the risk of breathing difficulties. Give your baby a pacifier. Consider giving your child a pacifier in the crib. Studies have shown that pacifier use is linked to a reduction in SUID. Do not force your baby to take the pacifier, but offer it gently. If you choose to use a pacifier, make sure you give it to your baby before he or she falls asleep, not during sleep. Breastfeeding. Breastfeeding also reduces the risk of SUID. It's recommended to breastfeed your baby for at least 6 months, but any amount of breastfeeding is better than none. Here are some benefits of breastfeeding. Improves your baby's breathing and swallowing coordination. Reduces your baby's chance of infections. Reduces your baby's chance of respiratory issues. But one important note, always stay alert when breastfeeding or giving your baby a bottle. You don't want to fall asleep with your baby because the risk of SUID goes up, especially if you're on a couch or recliner. Don't smoke. Smoking increases the risk of sudden infant deaths, so be sure to maintain a smoke-free environment, not just in you and your baby's room, but in your entire home. Inform others. Lastly, be sure that anyone who cares for your baby understands the steps we've outlined in this video. In fact, you can send friends, family, or caregivers at any time to kernmedical.com/safebabies to watch this video in preparation of your baby's care. And now, let's look at the safety tips again. Put your baby to sleep on his or her back. Check your baby's crib. Room share, don't bed share. Dress your baby in light clothing. Keep the room at a moderate temperature. Give your baby a pacifier. Breastfeed your baby. Don't smoke. Inform others. And you, as a new mom, can also take a refresher course with this video once you get settled at home. It is our mission at Kern Medical to rid Bakersfield and Kern County of sudden unexpected infant deaths. We wish you and your baby health for life.